Hi, I'm Susan Taylor with Scripps Health in San Diego, California. When we think about a heart attack, what comes to mind? Pain in the chest, shortness of breath. Heart disease is the #1 killer for women. It takes the lives of nearly twice as many women as all forms of cancer combined. Ladies, have you ever been tired, dizzy, had neck pain, jaw pain, indigestion? How many of you went to urgent care for those symptoms? How many of you blew those symptoms off? We're always tired, right? Because we're running from work to pick up the kids from soccer, piano, rushing to get home, put dinner on the table. Maybe we've had one too many hot dogs to give us that upset stomach. And the neck pain, well, we're carrying a lot of weight. Maybe we're carrying strollers. Maybe we're caring for our older parents who are picking up wheelchairs. Maybe we're carrying too many groceries, or we've been lifting heavy weights at the gym. But those 4 symptoms, tired, dizzy, neck pain, jaw pain, indigestion, are all symptoms of a heart attack in women, and in some cases, those symptoms will show up more than a month before the heart attack. Now, don't freak out. We're going to put it all in perspective for you. I'd like to introduce you to 2 of our stellar female cardiologists from the Scripps Women's Heart Center, which is located on the campus of Scripps Memorial Hospital in La Jolla, California, just off Genesee Avenue. Doctors Paulina Udine and Christina Adams, thank you both for being here.
Thank you.
So we touched on a couple of this. Are heart attack symptoms for women, are they ever the classic symptoms that men get, the
Yes.
sharp chest pain?
Yeah.
Or is it more subtle a lot of the times?
It can be more subtle, but it's really important that women do recognize the classic symptoms, left-sided chest pressure. And in fact, a lot of patients will correct us. They say it's not pain, it's pressure, shortness of breath.
Yeah.
But
Sometimes
as you
stigma with the terms, they just don't want to admit. But yeah, they will have the classic symptoms sometimes for sure.
But you brought up a really important point. These subtler symptoms, epigastric pain, unusual fatigue, shortness of breath, women we know have higher pain thresholds. So typically we'll say, oh, it's not this, or we're not actually taught also that heart disease is a woman's disease. Typically it's been taught, even with physicians, that this is more of a male-dominant disease. And we do have higher pain thresholds, so we kind of negate the symptoms.
So how long could these heart attack symptoms last?
Yeah, so that's a great question because, some people will say, oh, well, I always have indigestion. I've had it for years. But, all of a sudden they'll come in one day and I'll say, well, why did you want to see your doctor today for a symptom you've had for years? And oftentimes they'll say, well, it was really different today, or it was worse today. So, that's one presentation. But then other times we see somebody who says, I was perfectly fine until all of a sudden a week ago I started to have all these non-specific or vague symptoms. So that's the really tricky part about it. Depending on how active somebody is, what their baseline risk factors are, the presentation can be something that just suddenly came on a few days ago, or it could be something that's going on for months to years unrecognized. And I think that's kind of where our job comes in a little bit to help tease out, okay, is this just, aches and pains you've always had, or is there actually something serious going on that needs a little more workup?
And is it something that comes in a cluster, like all of these symptoms together?
Not necessarily. So as you pointed out, 2 weeks before a heart attack, women are more likely to describe unusual fatigue. The day of presentation, it typically tends to accelerate into more specific symptoms of shortness of breath or chest pain. But what I always tell women is, and this is why we really emphasize, I want people doing moderate to vigorous exercise regularly.
Absolutely.
Because if you're noticing a change in your exercise tolerance, if you notice that, you know what, my workouts have changed, I can't do my normal activity, I used to walk this hill regularly, now it's giving me more trouble, that can be a very early sign that we need to check some things out.
Yeah, those are the red flags. And it's actually very helpful. I know we both do this even after, let's say a woman has already had a heart attack or had a stent or something, and they're saying, well, how do I know if this is going to happen again? What symptoms should I look out for? Can I exercise? They become very nervous, obviously, for obvious reasons. And so we say the same thing again. Once we feel that everything's kind of compensated, we say, you better, start exercising again and see, because what we really want to know is a change from your normal functional routine. It may not be chest pain. It may just be fatigue or shortness of breath. But if somebody says, well, gee, normally I can get on the treadmill for 30 minutes, no problem. And this past month, I really get tired after 10 minutes or 5 minutes. We know something has come up, and they don't necessarily have to use the word chest pain or jaw pain, just something different.
So when do you blow the symptoms off? And when do you go to the emergency room, or when do you go to urgent care?
Yeah, so that's tough. So the first thing we always tell women is, one, know your numbers. So get a baseline good evaluation with your primary care provider. What's your cholesterol? Do you have diabetes? How's your blood pressure running? Is your weight normal? What's your family history? Have an idea of, you know what, I'm actually a low risk person, I'm an intermediate risk person. And then again, I push this all the time. Get into a regular exercise program, okay? The reality is people want to know, is this heart disease or is this not? Well, there is no magic bullet for diagnosis. In fact, we even know that stress tests don't necessarily predict heart attacks. They help to re-stratify, is this chest pain, is this cardiac, is this not cardiac?
What do you mean re-stratify?
So, for example, like when somebody will come in and say, you know what, I want a cardiovascular workup, I want to make sure my heart is healthy or strong. There's several different types of tests we can do. Obviously, we'll do an EKG, sometimes we'll do an echocardiogram, which looks at the walls of the heart and the valves and the structure and the function. And then sometimes we'll recommend a stress test. And even with stress tests, there's several different types depending on what we're looking for. And what I always tell patients is, you know, the stress test, if it's normal, gives us pretty good confidence in the 90 to 95% range that maybe everything's okay, but it can miss things. And actually in women, it can miss things more often than in men. It can either miss something that's there or it can overdiagnose something. It can actually be at what we call a false positive, where it makes it seem like something there that's not. And so what we have to do is put it in the context of what Dr. Adams is saying. Well, does this person have a strong family history? Do they have a lot of risk factors? Are these symptoms typical or atypical, kind of like what the ones you had mentioned?
But acutely, though, acutely, listen to your woman's intuition.
Absolutely.
If this is weird, if this is concerning, and so many patients will say, I don't know how to explain it, this just doesn't feel right. That's kind of your spidey sense going off and you're saying, you know what, let's check this out.
So checking out, do you go to the ER, emergency room, or you go to urgent care, or is there?
I think it's whatever's closest to you depending on what you're feeling. If you're saying, okay, I've had this nagging ache for a couple months, I want to get it checked out, you could maybe call your doctor and see what they say. But if something's new that feels scary and unusual to you, and when you were asking what do you blow off, we actually say blow off nothing. If you really don't know, it's something new, and you don't know what's happening, we say either call 911, go to the emergency room, have somebody drive you there, whatever it is.
Yeah, because there are some acute blood tests that can be done to make sure that you're not having an acute event. You say, okay, nothing's happening right at this moment, and then you can actually continue with the workup, and then you can possibly do a stress test, even as an outpatient. It doesn't necessarily mean you're going to be admitted to the hospital, but women need to be aware that changes in symptoms, they need to know their numbers, they need to say, these are new symptoms for me, I don't know what it is, but I can't explain it, definitely get it checked out.
Okay. In just a couple of minutes, we are going to talk about the importance of brushing your teeth.
Very important.
So hold on to that thought for a couple of minutes. Talk about the role of hormones and menopause in terms of women and heart disease.
Topic.
Another tricky one.
Well, hot topic.
Somewhat controversial too.
Well, we definitely know that after menopause, some very important things happen with women. The blood pressure tends to go up. The good cholesterol drops. The bad cholesterol goes up. Our metabolism goes down.
All the worst case scenario.
Right.
I know.
So
and then you feel bad.
That's why after menopause, women tend to catch up with men in regards of heart disease. Women are more likely to be diagnosed with heart disease postmenopausal a decade later than men. Now, there are going to be new recommendations coming out about hormone replacement. The consensus still is we do not use hormones to prevent coronary disease. It's far more complicated than just saying estrogen is protective. It's the same thing though. Exercise, know your numbers, use hormone replacement therapy if you're having side effects of menopause or you're having postmenopausal symptoms.
Yeah, knowing that it will probably be recommended to be a temporary thing.
Yes.
So, for example, you know, the guidelines have changed on that throughout the years. There was a time where women were just using, you know, estrogen or progesterone because of menopause symptoms pretty liberally. And that's changed more recently because there's been some studies that suggest possible increased risk of stroke, possible you know, blood clots. And the truth is it's not the same for every woman, as you can imagine. It depends on, is this somebody who's, you know, had a lot of blood clots before? Is this somebody who's had cancers that run in the family? And so the recommendation would actually be different for different women as far as how much hormone replacement therapy they can actually take, whether or not it's safe. And so that makes it even more tricky because a lot of women will say, well, you know, my neighbor's taking her, you know, whatever, and she feels great. Can I take the same thing? And the answer is not necessarily. So that makes it tricky too.
But also interestingly, recently just released in circulation information, again, a growing understanding of the association between breast cancer, particularly certain breast cancer treatments, and an increased risk of cardiovascular disease. So what we really want to impress upon women is, again, knowing your risk. If you had breast cancer and you had certain radiation therapies or certain chemotherapeutic agents, that also may increase your overall cardiovascular risk. But this is what makes it more complicated, because women are presenting at later ages with more comorbidities, meaning they have more risk factors. But again, typically with higher pain thresholds, more difficult symptoms to really ascertain, is this cardiac, is this non-cardiac? Women just need to say, hey, I got to get checked out.
So when should you really start paying attention to your heart?
Oh, I love that question. So I actually think it's never too soon. And the reason is, A, you just want to get into those good habits of establishing with a physician or healthcare provider and, knowing your, like Adam says, knowing your numbers, knowing your personal risk profile, which is very different than your friend or your neighbor. But the other thing, too, is, we focus a lot on heart disease, coronary disease, but that doesn't actually take into account all of the other things that could possibly be going on in the cardiovascular system: blood pressure, arrhythmias, particular electrical abnormalities, valvular issues. And those don't necessarily always come on at later age or menopausal. Some of them are congenital. They can be there from birth. Some can develop in the 20s or 30s. And so I think that, just like you see a pediatrician when you're little, I think as people get into their early 20s, it's time to at least establish care.
Yeah, but very
decide.
Importantly, pregnancy though. So we tell women pregnancy is a woman's first stress test. So we now know that women who have preeclampsia, high blood pressure, even borderline high blood pressure during pregnancy,
or gestational diabetes,
even if those risk factors completely go away after the delivery of the child, that increases your risk of coronary disease 20 or 30 years down the road. So you kind of already have the first glimpse of, hey, I've got to get down that lifestyle changes. I've got to get my numbers, because I know that that's the first glimpse of a cardiovascular risk.
Yeah, and if you think about it, at that point, let's say the woman is pregnant, then the next several years are spent really focused on the child's health and the family. And so if something did come up during pregnancy, if it resolves after,
we don't think about it.
Exactly.
Right?
That's a great time to ignore things, but not
that's
really.
Your glimpse. And that's why cardiovascular disease really should be more of a preventative component. Once you have the heart attack, once you have the stents, it's really hard to reverse disease. What we'd prefer is that our culture shift towards preventing cardiovascular disease.
So what are the questions you should be asking yourself?
Oh.
Well, okay. So first of
there's
all,
a few.
Yeah. So do you know your numbers?
And by numbers, we mean what's your cholesterol, blood pressure,
waist circumference, okay? What's my family history? And be specific. What age did mom or dad have a heart attack or have stents, okay? Am I a lifetime non-smoker? Do I have any other, what we call inflammatory diseases? Lupus, rheumatoid arthritis. We now think that inflammation is a associated risk factor of heart disease. So we know patients who have chronic inflammatory states are at increased risks.
And then, go ahead. The other thing too, which we haven't even talked about yet, but I'm sure we will, is actually just regular old stress, just the daily daily stressors in life. Do you have a very stressful job? How do you cope with stress? Do you have symptoms with stress or anxiety? Are you a caregiver for somebody, like let's say perhaps a spouse or an aging parent? Those have actually been shown to contribute significantly just from the stress alone, the inflammation, the fact that it may keep somebody from exercising or having a proper diet.
Yeah, we typically tend to take poor care of ourselves,
and then
poor
take
sleep,
great care of someone
less
else.
Diet when we're undergoing stress. And we know that traumatic events that have even occurred during childhood or young adulthood, we do know that that does increase the risk.
Well, you talk about traumatic events. They talk about women. She died of a broken heart. But there's actually a physical response to a traumatic event. Can you explain that?
Absolutely. So it's actually called Takotsubo cardiomyopathy. It's got a Japanese name. It's named after octopus trap because that's the shape that the heart takes when it happens. But really, what's happening is it's purely a extreme stress response that causes a physiologic response in the body. So for example, a woman, and it doesn't have to be a woman, but it is more common in women, will present with all the symptoms of a classic heart attack, chest pain, maybe shortness of breath, and they'll go to the emergency room and their EKG and maybe even their lab work will indicate that they're having a heart attack. But if you go and you look at their coronary arteries, they're actually wide open. There's no obvious blockages. But if you look at the shape of their heart, it will dilate a little bit like that octopus trap. And it's presumed that that is a physiologic response to extreme stress hormones circulating in the body.
It's one of the greatest examples of the link between the head and the heart.
Yes,
Okay.
and if you ask those people, and like I said, it doesn't have to be women, but if you ask those people what happened to you, usually they'll tell you something really severe, like I had a really bad car accident, or my spouse just passed away, or I'm bankrupt, something very traumatizing. And the good news about that is oftentimes it actually does improve. And people can go completely back to normal. But as Dr. Adams was saying, it really highlights that somebody, just the influence of stress alone, how damaging that can be to the heart.
Has an effect on the heart,
Yeah.
absolutely.
All right, so let's come back to this, because we teased this a couple of minutes ago. Talk about the importance of brushing your teeth.
Well, you mentioned the inflammation. And so it's an area that, let's just say that you've got gum disease or something that you're unaware of. You've got a chronic low-grade amount of inflammation. That's enough to cause a systemic response in the body, similar to what Dr. Adams was referring to with lupus or other autoimmune issues. So that's one big factor. And we've actually seen in people who have had coronary disease or stents before, sometimes if they've got poor dentition or a lot of inflammation in the mouth or other areas, they tend to form scar faster within those stents that they already have. Not to mention, let's say if somebody goes with an uncontrolled tooth infection or something for a while, it can actually increase the risk of endocarditis, which is infection on the heart valves.
Okay. So you've got bacteria in the mouth.
Yeah, and it can enter the bloodstream, and we see that actually quite often.
we do, and I think the takeaway is that, again, we're learning more and more about the risk factors of heart disease. It's not always just cholesterol, diabetes, high blood pressure, family history, smoking. There are newer, novel markers that are signs of chronic inflammation. Again, going back to people that we know have chronic inflammatory states, they have more aggressive coronary disease, they have flares with their inflammatory disease states.
Yeah, we do see that a lot. When
so how do you reduce inflammation in the body then?
Exercise. So exercise is one of,
and also what you put in. I mean, it's
an anti-inflammatory diet,
huge,
right? So we really stress, and most of the anti-inflammatory diet is also anti-cancer. It's great for diabetes, but it's getting rid of those simple sugars, the white flour, the white rice, the breads, the pastas, all that empty calories.
The more packaging something comes in, probably it's less good for you. I know that's, the more little wrappers and things you have to open. We're big fans of kind of whole, real foods where you can actually understand what it is that you're eating and recognizing where that food product came from.
Lots of fruits and vegetables,
absolutely,
grains. All right. Why is it so important? I mean, Scripps has opened this new Women's Heart Center. It's heart care for women by women. There's 4 female cardiologists. You were 2 of the 4. Why is it important to have a Women's Heart Center?
Oh.
Again, because this is the disease of women in America right now. This is a highly preventable disease, but it happens to be the #1 killer of women in the United States. And we ignore care. We get less aggressive care historically. We are involved in less research studies.
I think that's a really important point to bring up the awareness of that.
Different presentations. It needs to be part of our kind of public collective consciousness of saying, this is a disease that I can actually improve upon. And you're going to be taking better care of your families if you understand your own inherent disease. Women are always taking care of everyone. But women have to understand this is a women's disease. This is the disease that's killing women in America right now.
So what do you offer at the Women's Heart Center?
So we offer the full spectrum, what we want to say all of cardiac care. And it's, we'll take everybody. If somebody just wants to talk about, hey, I feel fine, but I just want to know what's my baseline risk, we'll sit with them, we'll figure it out, and we'll determine, if there's any need to do any advanced testing or, stress testing, some of those things we talked about. So we're happy to take care of what we call primary prevention. But we're all cardiologists, board certified in more than a couple of things between all of us, and so we'll do whatever they need. If somebody wants to come in, if they need a stent, if they need a pacemaker.
But specifically to the Heart Center for women, we made it a very different type of clinic experience. So before you even come in for your appointment, you've completed about an 11, 12-page questionnaire, which really gets to the meat of how is your health? What's the family history? What are your other associated risks that a lot of women don't even know about yet? We ask about pregnancy. We ask about hormone therapy. We ask about breast cancer risk. So by the time they come into their visit, we've reviewed their entire
we already know them, and we discuss it with each other even before the patient comes in.
We've possibly ordered labs. The idea is a really comprehensive visit. So these women who necessarily don't need to see a cardiologist, but just say, I want to know my overall risk. I want to better understand what I should be looking for. They leave that visit knowing these are my numbers. these are my goals.
Yeah.
Right?
And
this is what I got to look out for. And maybe we'll see them back in a year.
Or maybe we'll see them back in a month, depending on what's going on.
Depending on what's going on. But the idea, it's about knowledge. It's about empowerment. It's about letting women not be so anxious about heart disease, but really having a better understanding.
Yeah, also not being afraid to come in and say, you know what, maybe I do have chest pain, maybe I do have coronary artery disease, and that's okay. And we actually have a support group, you know, that goes with it as well for women, and it meets once a month, you know, in Rancho Bernardo. And so, you know, that's there as well. You know, what we had talked about when we tried to create how we want the office visit to go for the Women's Heart Center, we said, you know, we want them to leave as an absolute expert on their overall health. Yeah, it doesn't even just have to be cardiology, but just we want them to, you know, what we don't want is somebody walking away saying, I don't know what my doctor said, I don't understand. And unfortunately, we find that a lot where people are intimidated to ask their questions, or they think they understand, and they go home and they realize they actually didn't really know what we were talking about. And so that was our goal, is for them to leave saying, I totally get it. I have a plan for the next whatever year,
Here's
6
my
months.
Starting point to lower my risk.
Exactly.
Right.
So they, like you said, they feel empowered and they're like ready to make these changes.
Knowledge is power.
Absolutely.
Yeah.
Absolutely.
Final thoughts?
Yeah.
Final thoughts.
Well, I think that one of the things that I think 2018 is turning out to be a year about women empowerment. Mm-hmm. We all know that. And there's been a lot of rising consciousness about what do women need to do for themselves. And I would encourage every woman in California and the United States to really say, you know what, this is the year. Mm-hmm. I'm going to set some health goals. Mm-hmm. I'm going to work with my physician to meet those health goals. And I'm going to feel more empowered to say, you know what, I'll thank my cardiologist when I'm 90 and I'm feeling fantastic. But we really want to change the course of where this disease is going. Yeah. Most heart disease, people should know, is preventable.
Exactly. And I think that knowledge isn't there, or maybe it's becoming there. And the other thing, too, as you were saying, I mean, it's the time for women to not feel stigmatized or guilty or any of those things when they take time for themselves, not be worried about what the label of a diagnosis is, but to actually just learn what are these terms we're talking about, and then maybe even go on to teach it, you know, to their mothers or their daughters, so that it's a cycle that just keeps going, is what our hope is.
And if you have those 4 symptoms in a cluster, tired, dizzy, neck pain, jaw pain, indigestion,
get it checked out.
Never blow it off, we say.
Get it checked out.
You got it.
Get it checked out.
Maybe brush your teeth.
Thank you both so much,
Thanks,
Drs.
Susan.
Adams and Nadine. We appreciate it. If you would like more information about women and heart disease and our Scripps Women's Heart Center, just click on the link. If you would like more health information, we take care of you from head to toe at Scripps. So we urge you to please subscribe to our Scripps YouTube channel, and also follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.